Hi class, my name is Lindsay Judge and I chose to do my issue presentation this semester on substance use. I chose substance use because of how prevalent an issue it is in our society today. Throughout the presentation, I'm going to discuss substance use, substance abuse, dependence. I'm going to talk about different multicultural factors when dealing with substance use, the school counselor's role in dealing with substance use, and developing a comprehensive counseling program that entails substance use, as well as the consequences of substance use and why students are using substances. So thank you all for listening, and I hope you enjoy my presentation today. So first I wanted to start with what is substance use? So substance use is the consumption of alcohol or drugs, but substance use could be something as common as having a beer with a friend at dinner. It's that would be considered substance use. Substance use doesn't necessarily have to be a problem or lead to abuse or dependency in certain people. Um, Substance abuse, however, is the continued use of drugs or alcohol even when it's causing problems. So, substance abuse is when someone continues using drugs or alcohol even when it's causing problems, whether it's at work or with family or with their health. Um, Substance abuse could be continuing to use drugs even though you know you're going to be fired if you fail a drug test. That could be a sign of abusing substances. And then there's substance dependence. So substance dependence would be the addiction to alcohol or drug. So you're dependent on that substance. So when someone is unable to stop drinking or using drugs, when they're dependent, they'll have withdrawal symptoms when they try to quit. So it's definitely a little bit more serious than abuse or use. Substance use, abuse, and dependence are among the leading causes of adolescent death in the United States. So it's a significant issue. I think that all school counselors need to focus on substance use at some point in their career and develop comprehensive programs to combat this issue. So I first wanted to discuss alcohol use in high schoolers, and I first wanted to discuss alcohol use because it is the most commonly used drug among high school students. So students are using alcohol more than they are using drugs or tobacco. Um, this is significant because the teenage brain is still developing, which means it's more prone to damage from drinking. So research is now shedding light on how drinking impacts the teenage brain. And not only are teens more sensitive to the effects of alcohol, but they're more likely to end up with long-term brain damage from drinking. So research shows that teens who drink by the age of 13 have a 43% chance of becoming an alcoholic, while those who begin drinking at age 21 have a 10% chance. So students who start drinking at a younger age are significantly higher at risk of becoming alcoholics than those who wait until they're 21. 35.4% of 10th graders and 48.6% of 12th graders admit having consumed alcohol within the past month. 10% of sophomores and 17% of seniors that were surveyed said they engaged in binge drinking. Now, binge drinking is defined as having 5 or more drinks in a row. And then in the United States, high school students abuse alcohol more than any drug. So it causes the most harm, alcohol use. And underage drinking is responsible for emergency department visits and deaths every year. So alcohol use is responsible for 119,000 emergency department visits and 4,300 deaths each year under people among people under the age of 21. So it's a significant issue. Next, I wanted to discuss drug use. Those who abuse drugs and alcohol at a younger age are more likely to develop addiction later in life. Nearly one half of the United States high school students are aware of a student who sells drugs at their school. And Adderall is the most frequently used prescription drug by 12th graders in the United States. Adderall is a stimulant that's used to treat attention deficit and hyperactivity disorder, so ADD and ADHD. After Adderall is tranquilizers, prescription opioids, cough and cold medicines, and sedatives. So nearly 10% of high school students also said that they had vaped marijuana sometime in the past 12 months, while 20.8% of 10th and 25.4% of 12th graders reported using illicit substances in the last month. So even though use of illicit substances such as heroin, cocaine, steroids, synthetic marijuana, and meth is very low among high school students, they are still engaging in drug use. So I did just want to discuss the use of drugs and alcohol a little bit further. Um, Fortunately, most young people who are experimenting with substances won't develop an addiction, but some will. So 1 out of 10 individuals who experiment with drug and alcohol become addicted. So 1 out of 10, 10%, that's a pretty significant number. So even though the overall rate of teen and drug use has been declining in recent years, most high school students will have experimented with drugs and alcohol by the time they graduate. When surveyed, 52% of teens said that there are places in or near their school where teens can go to drink and smoke or use drugs during the school day. So students know where to go to participate in this kind of behavior. 20% of high school students have been offered, sold, or given drugs on school property in the past year. So this is happening right under school counselors, teachers, administrators' noses. So it is preventable, at least in the school setting. I also briefly wanted to touch on tobacco use. Tobacco is considered a gateway drug, and it's oftentimes the first substance that a student uses prior to drinking or drugs. So it's correlated with the use of other drugs. High school students who reported smoking 1 or 2 days during the last 30 days were 5 times as likely to report marijuana use than non-smokers, and the students who reported smoking cigarettes every day for a month were 25 times more likely to report marijuana use. So students who engage in cigarette use are much more likely to report using drugs. And even though cigarette use is on the decline, vaping is on the rise, with more than 1 in 4 high school seniors reporting vaping in the past year, and 10% of students saying they vape marijuana sometime in the past 12 months. So as we all have seen on the news, vaping is growing into a tremendous issue. Next, I just wanted to talk about the diagnosis criteria for substance dependence. So how do we know when a student is dependent on a type of substance, any of the 3 that I just mentioned before? So some signs that counselors, parents, teachers, administrators can look for are higher tolerance of a type of drug or alcohol or tobacco, symptoms of withdrawal from whatever substance they're using, taking substances in greater amounts over longer periods of time. So just kind of gaining a tolerance for whatever substance they're using, a constant need for that substance, spending a lot of time trying to obtain that substance, having it starting to kind of consume the student's life, spending a lot of time on the substance and giving up on activities that were important prior to substance use. So if students are no longer participating in after school activities or in athletics or in clubs, that may be a sign of substance dependence, as well as continuing using the substance despite it causing problems in their everyday life, whether that be at home or with family or with loved ones, friends, whatever it might be. Next, I just wanted to talk about what a typical high school student is facing. Why might they lead to using substances? What are they going through at this point in their lives? So as we all know, high school is a transitional period in a person's life. They're going through a lot. So a typical high school student is faced with important decisions regarding their lives for the first time. A typical high school student is faced with many decisions, and staying drug-free is only one of those decisions. A typical high school student is near the end of their physical maturation, but is still developing emotionally, socially, and intellectually. A typical high school student is beginning to be concerned with the future for the first time. They're experimenting with being independent for the first time. A typical high school student is in need of acceptance and group identification, regardless of the fact that they're still starting to become independent adults. The typical high school student needs to be challenged. They need to develop critical thinking skills. They need to be involved in their learning. This is super important for a high school student in order to keep them engaged in their learning process. So, as if the reasons I just mentioned in the previous slide weren't enough, why are high school students engaging in substance use? So I'm just going to name a couple reasons why. Peer pressure, for starters. So peer pressure is the influence from the people in one's social group or setting. But not all peer pressure is bad. This influence can cause people to act more responsibly, to join sports teams, to engage in after-school activities, to start clubs. But for the purpose of engaging in substance use, students may be dealing with peer pressure to participate in that kind of behavior. They may be engaging in substance use because of their neighborhood atmosphere. They might not live in the best neighborhood, and students that they know, their neighbors, may be engaging in substance use, and that may lead them to engage in that behavior themselves. Self-medication. They may be self-medicating, whether it's for mental health issues, whether it's for depression, whether it's to relieve some sort of physical pain, mental pain. Parental drug use. Their parents may be using drugs. This may be normal for them. They might have a disorganized family life, so they may turn to alcohol or drug use or tobacco use. Family history or family violence. Turbulence at home is a big reason why students may turn to this type of behavior. They may be anxious. They might just be rebelling against society or against their family. Um, Easy access and availability. It might just be super easy for these students to have access to drugs and alcohol, and it could snowball into substance abuse and dependence. There might be they might be doing it for academic pressure. Maybe they're using Adderall because they want to improve their test scores. So these are just a couple of reasons why students might engage in substance use. So I did just want to briefly mention the consequences of substance use. As I mentioned earlier, students that engage in substance use have a higher risk of addiction and dependence, but they are also at risk for brain abnormalities, slowed thinking, impaired learning, impaired memory, depression, impaired decision making. You know, if a student is on drugs or alcohol, they're obviously not in their right mind and may lead to, drinking and driving or other bad decisions, as well as negative academic performance. So next, I just wanted to discuss the school counselor's role in substance use. Um, as we all know, the school counselor is a source of support for their students in their lives. School counselors get to see their students every single day, so they're truly there to support them throughout their school careers. So school counselors offer support in students' academics, in their social lives, for their mental health, and for substance abuse concerns. Um, when students were asked, they said that one of the people that they would talk to about substance use problems is their school counselor. So they're willing to have that conversation. Counselors might be the first professional contact for a student with a substance use problem in many school settings. So it's important that they're fully prepared to deal with this if and when the situation presents itself. The school counselor can be a source of support for students in many different areas of their lives, whether it's academically, socially, mentally. The school counselor can assist a student with identifying a problem and referring them to the appropriate resources. So the school counselor can make a huge difference in a student's life when it comes to substance abuse issues. So what is the role of the school counselor when dealing with this? So um, how can the school counselor provide support to at-risk students? So the school counselor can discuss different, availability of different counseling offices with the students, different job opportunities and recreational activities to um, get their mind off using drugs and encouraging them to get involved in the community, in positive social activities and in school programs, to kind of get them out of that dangerous environment. The school counselor can serve as a liaison for students with their concerns. They can facilitate assessments for learning disabilities, health concerns, psychological concerns, and family functioning. The school counselor can involve parents when necessary. So the parents are obviously vital to a student's success. So a counselor can collaborate and work with a student's parent on prevention plans, on training them when to know if their child is using drugs or alcohol, and prepare them for involvement, so creating a climate of trust to assist students with enhancing their ability to deal with this issues as they face them is definitely important. So incorporating shaping, modeling, role playing, one-on-one counseling, group counseling, assertiveness trainings, and other, behavioral and cognitive approaches into the school counseling programs is extremely important, and also providing accountability factors. So this is extremely important in validating the progress and that a student's made, and documenting the student's substance use and misuse, and also the progress that they've made. So the school counselor has a ton of different opportunities to help and provide support for students that are at risk. So, what does a counselor need to do to produce a comprehensive school counseling program? What does a comprehensive school counseling program need to entail? So, a school counseling program needs to be health oriented. It needs to emphasize personal development. It needs to address problem solving, decision making, communication, coping, and social skills. It has to address assertiveness training and impulse control. It has to include information on study skills and time management and how to make friends and how to avoid peer pressure. This is super important because students are going to be presented with the opportunity to participate in substance use, and they need to have the tools in their toolbox to be able to turn those opportunities down and say no. A comprehensive school counseling program needs to be ongoing. It has to be, in consultation with the stakeholders, with the school psychologists, with teachers, with social workers, and administration to make sure that the counseling program is the best it can possibly be. It has to include prevention programming. So not only is it for students that are already using substances, but to prevent them from even getting to that point. It should include extracurricular activities both before and after school that are anti-drug oriented. So to kind of get students involved in positive activities. It should also include policies and procedures for students who are already engaging in substance use. And it should be age appropriate. So it should be, if it's for high school students, it should be appropriate for high school students. And also it should be appropriate for students from different multicultural backgrounds. So obviously not every student is the same. So it needs to be formatted to be able to be appropriate for all students. So Going off of that, I did want to mention socioeconomic status and substance use. Students who have a low socioeconomic status are using drugs and alcohol more frequently than students who do not come from a low socioeconomic status background. Students with low SES or socioeconomic status use drugs and alcohol as a coping mechanism to handle the stressors of their environment. Low income is associated with higher substance use, and lower parental education is also associated with higher substance abuse. Students with a low socioeconomic status are more inclined to use illegal substances than those who do not come from a low socioeconomic status. The next group I wanted to discuss is gender minorities and substance use. Gender minority is defined as a sexual minority that is defined as a group whose sexual identity, orientation, or practices differ from most of the surrounding society. School-related minority stressors to this group may include being bullied, harassed, or attacked at school, and non-school related sources of stress experienced by sexual minority youth might include early sexual debuts, forced sexual intercourse, and other adverse childhood experiences. School and community-based strategies to improve access to social mental health services may be able to reduce this minority stress and substance use by preventing the effects of physical, psychological, or sexual abuse. Gender minority and sexual minority adolescents report greater substance use than non-minority students, and this is attributed to increased stress from preconceptions, discrimination, bullying, harassment, just because of their sexual preferences. So all categories of substance use were significantly higher among students who identify themselves as gay, lesbian, bisexual, or than those who identify themselves as heterosexual. So substance use prevention programs may benefit from targeting gender minorities and providing a safe place and support for bullying and harassment of sexual minorities. So next I wanted to discuss Project Success. Project Success is a substance use prevention program that was created to target high-risk students. Project Success stands for Schools Using Coordinated Community Efforts to Strengthen Students. Substance abuse programs are found most effective when they are directed at high school age students who demonstrate risk behaviors. So research shows that programs that target specific populations are more effective than programs that are universal. So students reported less drug use after the first implementation of the Project Success program. Its Project Success consists of 4 components. So it has the prevention series. It's a 4-topic substance use prevention program taught to small groups in 6 to 8 weekly sessions. There's also individual and group counseling, as well as communication with parents, and then referrals to community agencies. So there was a study done, and in the control group, schools reported significantly less use of illegal drugs, however, not including marijuana, than those in the intervention group. So unfortunately, the effects didn't persist 1 year later. So they found no other effects that suggested that students receiving the Project Success differed from those who didn't receive it. So this particular program was a little bit controversial, but these results did stand in contrast to the positive effects that were found from 2 prior evaluations of Project Success that employed, multiple group designs. So given the lack of consistent positive findings for these types of programs, it's not there's a lot of ongoing discussion about whether or not these programs are effective, and whether or not they should be accountable for less drug use after implementation. So next I'm going to be discussing a study that was conducted by Burrow, Sanchez, and Lopez that found that there was a great need to further understand how high school counselors perceive their ability to work with students with substance abuse issues. The general research questions that guided this study were: what are high school counselors' current training levels for working with students with substance abuse issues? What training areas do school counselors identify as being the most important for working with substance abuse problems? And what substances do high school counselors identify as being most common in their schools? High school counselors reported different levels of training concerning specific competence areas for substance abuse. Counselors also clearly identified 2 to 3 important areas for further training for working with high school students who abuse substances. And counselors also identified alcohol and marijuana as being more prevalent with their students on their campuses. High school counselors in this study reported that they had different levels of training for working with students with substance abuse issues in their schools. They also stated that consultation with teachers and parents and stakeholders was extremely important, given that counselors spend a large amount of their time consulting with other school personnel, such as teachers, administrators, parents, regarding the academic, career, personal, and social needs of their students. Counselors, however, didn't strongly endorse their ability to identify students with substance abuse problems or work effectively with these students and develop or teach curriculum units on this topic. Of the sample that was reported, half of them didn't even take a course on substance use in graduate school, and almost half indicated that their school or their school district that they work at didn't provide any training on this topic in the past 3 years. So this was definitely concerning. So school counselors were asked about their school's procedures for identifying students with substance abuse problems, and 46% of counselors indicated that their school didn't have a formalized procedure for identifying students with substance abuse problems. So almost half. So that is an extremely concerning number. 38% of the counselors indicated their school was not effective in identifying students with substance abuse problems. And 20.2% reported being unsure of the effectiveness of the programs that they offer. So they weren't even sure if what they're offering is helpful. 62% indicated that at least 6% of the students at their school had substance abuse problems, while 41.8% indicated that more than 10% of their school experienced substance abuse problems. So their counselors do feel that their students are experiencing substance abuse issues. Counselors felt most prepared and comfortable counseling students when the drugs that they were counseling them for were alcohol, tobacco, and marijuana, but they felt least prepared counseling students when the drugs were inhalants, stimulants, hallucinogens, or steroids. And 30% of counselors indicated that they felt neither adequately prepared or comfortable in identifying substance problems. When they asked what kind of drugs they would want more information on counseling, half the sample of counselors that were surveyed wanted more information on alcohol, tobacco, and marijuana, and 2/3 of the survey wanted more information on inhalants, stimulants, hallucinogens, steroids, and over-the-counter drugs. So how do the school counselors perceive their preparation for dealing with students who are using substances? 47% of counselors reported having taken a drug counseling course in graduate school, and 55% indicated taking a drug education course in graduate school. So about half the sample. So that's not great. 38% of the sample indicated that screening and assessment was the most important area to receive training, and 37% indicated that intervention was the most important area for them to receive training in. Individual interventions can be used by school counselors to motivate students to identify the problems and to seek further treatment. Screening and individual intervention are two needed areas for high school counselors to effectively work with students with substance abuse problems. They need to be able to screen that this is a problem and to intervene when it is identified. And the study also found that one indicator of the counselor's workload um, as not being a factor in their willingness to attend substance abuse training. So even though counselors have a very large caseload, they're still willing to receive additional training on this and improve their ability to work with this population of students. So just to piggyback off of the last slide, almost half the sample indicated that their school or school district hadn't provided any training on substance use in the past 3 years. So as you know, things are always constantly evolving and changing, and issues are growing. And just as vaping is on the rise and cigarette use is on the decline, things are constantly changing. So school counselors should be provided training in these areas consistently. Counselors also expressed a concern about the lack of time in a typical day to meet with students and provide these direct services for substance counseling. Some of the counselors stated they're required to spend so much of their day in front of a computer dealing with scheduling issues instead of providing direct services to students, which is not how it's supposed to be. But counselors did strongly endorse that their willingness to attend training on substance abuse topics. And they strongly endorse the idea that counselors should receive these trainings in student substance abuse issues and within this topic. And counselors believe they should receive training in student substance abuse issues and are willing to attend these trainings to expand their knowledge and their skills. So in conclusion, substance use is a significant issue among high school students, and there are many reasons why students engage in substance use activity, whether it's because they're having problems at home or they're being peer pressured or they have a low socioeconomic status. Students have their reason for engaging in substance use, but it does have many consequences on their lives, and that's why it's extremely important that the school counselor has a big role in preventing substance use. But School counselors also need to be given the tools, and they need to be adequately prepared and trained to deal with students who are at risk for substance abuse issues, which through the findings of the studies, not all counselors are. Comprehensive prevention programs are essential in reducing substance use. So it's important that school counselors are continuously being trained in substance use, and that they're able to create prevention curriculum that are targeted to students um, by counselors, by teachers, by parents, by administration, as many stakeholders that can be involved in this process, the better. And if students have already begun to participate in substance use, counselors also need to be prepared with treatment interventions and follow-up programs available to those students who have already engaged in this behavior. So that is the end of my presentation. I just want to thank you all so much for listening, and I look forward to listening to all of your presentations. I hope you found this informative and educational. Thanks so much. And I just wanted to finish up with my reference page. Thank you again.